But that aside, the other niggling worry, of course, is the huge spike in COVID cases that you're seeing across the board in many states, and in particular in Maharashtra and cities like Mumbai. So let me welcome on board Dr. S. Narayani, Zonal Director, Fortis Hospitals, Mumbai. And we also have with us Dr. Hemant Thacker, Cardio-Metabolic Physician at Breach Candy Hospital. Both of you, thank you so much for taking the time out and joining in. Dr. Thacker, if I could start the conversation with you, help us understand how bad is the situation really, and whether the spike that you're seeing in, if I can call it the second wave of the virus, whether it's anywhere close to plateauing out or not.
You know, this is not a wave. It's a tidal wave in the form of numbers. It's a numerical tidal wave because we are seeing patients in droves and hordes. We are seeing buildings, families, groups, everything put together. Fortunately, the mutation of the virus is in a downward mode, so we are not seeing virulence. But definitely the city is inundated with quick transmissibility, plenty of numbers, and fortunately most of them subclinical or asymptomatic. But this is definitely disconcerting because we've had an explosion because of our negligence, carelessness, and a COVID fatigue or a sense of pseudo-confidence that came in owing to the vaccine being available and others getting it round the corner. So this is definitely concerning.
Yeah, absolutely. And that's the other thing, Mr. Thacker, that I wanted to speak to you about, because there's a lot of panic whether this fresh wave is of the mutant variant or, the second variant of the virus, typically known as the African or the UK variant or not. Is there any data to establish whether it's the mutated virus or not?
All I need to enlighten everybody that the word mutation is not a bad word. Mutation only means change. You can have a downward mutation or an upward mutation. As of now, it appears that there is a mutation, which of course will have to be confirmed by genome sequencing. But the virus has changed its mild genetic sequencing so that it spreads quickly, transmissibility is rapid. However, we are seeing that clinically, patients are not so much affected. Despite low CT values, which means a bad infection, we're seeing relatively lower symptoms. Now, that does not mean that we can sit on our haunches and relax, because this virus could very quickly get an upward mutation with increased virulence. So we have to be extremely, extremely vigilant, and strict action will need to be taken. People will need to be fined. People will need to be confined. And people will need to be taught discipline and obedience. If that does not happen, then we'll have to definitely see that we issue certain strong measures which could be bad, which if we are not careful, it's going to be detrimental to the economy and to the general people at large, the community.
Yeah, absolutely. Dr. Narayani, there are a lot of myths out there that the mutant variant of the virus is stronger, more contagious. It's also impacting children now below 10 years. And unfortunate as it may be, there is a lot of misinformation as well around there about COVID. Help us understand what really is the situation on ground according to you.
I'll start out by completely echoing the sentiments of the co-panelists. So the one thing which is certain is that we are seeing a huge spiraling out of numbers. We have a significantly higher number of cases getting reported. And like he mentioned, we used to get people coming in testing positive in singles and ones and twos. We get them like a bouquet. I mean, I'm actually using the word, there is a bouquet of patients all the time who are knocking on our doors saying that they're COVID positive. Now, so definitely we have a situation where the spread is far more. The spread is because it's a variant which is more contagious, or is it the spread is far more because of the fact that people are out and moving out, and there is absolutely a major disregard for COVID appropriate behavior. Either of them could be true because we don't really have evidence to say either this or that. So I would like to believe there is bit of both. Now, if there is a variant, as of now, what we do know for sure, so the best is not to speculate. And what we do know for sure is we have higher numbers, but we are not seeing clinically very severe infection in the majority of the population. And of all the people who are testing positive, more than 90% are almost asymptomatic and mildly symptomatic. So, the one thing through COVID which we have done phenomenally well and to our detriment is to speculate and, a lot of information which is not substantiated, which becomes a source of panic. I think we should completely pack that off. And we need to do only one thing. All of us need not worry about, is this a mutant, is this a variant, is this another spread, is it another age group which is getting affected? I don't think common people need to worry about this at all. All we need to understand is there is only one thing which we need to do. Mask up, whether it's a variant or whether it's the earlier variant. Masking up and social distancing, keeping your hands clean is good enough to save you from whichever virus it may be. So discipline, if we bring back, our situation should get under control. And all the measures which now BMC is forced to probably bring back in terms of a limited lockdown, which may be in the offering, or more severe measures in housing societies, are all a response to the fact that citizens by themselves are not taking responsibility either for their own health or for those around them. So the sum and substances, people should mask up, take responsibility for themselves. And I think we owe it to ourselves and owe it to the state that there's been so much which has been done in the last few months to try and bring life back to normalcy. We should not allow these surging numbers to trip us up and kind of push us back by, say, 4 or 5 months. And it's very simple to keep this under control. Let other people, the experts take care of whether it's a variant. Let experts take care of finding the bed. At an individual level, what each one of us could do is mask up, stay safe, stay confined, only step out if you need to. And do not assume that vaccination, a single dose is giving you a panacea or cure, and that you are kind of, you have a kavach which is going to save you from the virus. That's not true. So all the precautions which we were following at the beginning of the pandemic, with greater rigor, needs to be followed even now.
Yeah, absolutely. Otherwise, it's, almost feels like we're back to square one, exactly where we started off same time last year. But Dr. Thacker, again, on the subject of a lot of misinformation as well over there, are there newer symptoms like rashes on your bodies, discoloration of fingernails as well, which are added to the mutant virus symptoms this time around? Are there things that people need to look out for beyond your, flu, cold, cough, diarrhea symptoms?
See, you're going to get a plethora of symptoms coming up in a virus that affects the whole body. It's not a focal respiratory virus alone, which we know from last year. It can affect the kidneys, the heart, the gastric system, gastrointestinal system. It can affect the brain. And it can also affect the distribution through capillaries, veins, and arteries. But having said that, I don't want to confuse the layman by asking them to look for rashes and discoloration. If you have a fluish feeling, which means a conglomeration of feeling low, cough, fever, headache, then you have the virus. But as my co-panelist rightly said, you should not get the virus if you take adequate care. I don't want to bog people down saying, look for atypical symptoms, this is a mutant. You have forgotten to mask yourself. People have started going around with gay abandon. Weddings, parties, traveling, Maldives, Goa, Kashmir, everything is coming. Just because you have been chained or you have been caged doesn't mean that you can take law in your hands. Today, the CDC Atlanta and Joe Biden has issued a warning in the U.S. that if you don't mask up, this pandemic will come. And remember, the second wave of all pandemics is always worse than the first. If this virus, which has already changed its behavior in rapid transmission methods, if it takes up a nasty turn, we will have no medicines left. We are probably getting less mortality. We are having less morbidity. by virtue of the fact that we have lessons learned from last year and we have medicines set aside from last year. But if this increases, we'll have no medicines. And science is already fatigued. Scientists, doctors, nurses, ambulance drivers, police are all fed up. Do you know how monotonous it is for me to get up in the morning with the same thing, do the same thing? There's absolutely nothing else but COVID, COVID, and COVID. And this is man-made. So if we cannot look after ourselves, then we will need the Danda Raj for others to look after us. And if that happens, it's going to be really hurting the whole country and the whole world. You are in a situation. The Spanish flu lasted for 3 years. But one assumed that with modern medicine, a 3-year pandemic 1 century ago will become only a 1-year pandemic now. But obviously humans have not changed. Science may have changed. So unless we don't tame the people, and this is happening only in the places where there is access, where there is upper class, where there is money affordability to travel, to mix, to intermingle, to celebrate, this is happening. This time we are not seeing the lower strata. We are seeing the upper strata, the penthouses, the skyscrapers. We're seeing all these people getting affected. And they were not affected last year. So I think we have to take a leaf out of last year, behave ourselves. We are still in a place and in a stage where we can recorrect and go back. And at the same time, we have to now just push the vaccination drive. Step on the accelerator, get as many people vaccinated as we can. Already the government from the 1st of April has allowed anybody over 40 to take it, 45 to take it. I'm sure the government is now going to shift gears once more, and in a fortnight we'll allow everybody. But vaccination is a must, and self-discipline is here the whole of 2021. I think that's the message that I want to give everybody and your viewers.
Absolutely, point well noted, Dr. Thacker, and thank you so much for putting it in as many words, because we can't let the pandemic fatigue set in, and we can't, feel that one jab or 2 jabs are going to save us from the virus. We got to discipline ourselves. We've got to maintain the precautions, sanitize, mask up, and maintain social distancing. Dr. Narayani, thank you so much as well for taking your valuable time out and speaking with our viewers today. Thank you so much, both of you.